Joining us now to explain what needs to be done is Casey Hoyt, founder and CEO of VieMed, the largest independent supplier of ventilators in the U.S. And also with us is emergency room physician, former Navy commander, and a Republican candidate for Congress in Georgia, Dr. Richard McCormick. Mr. Hoyt, we'll begin with you. We've heard about ramped up ventilators and more production, yet we're hearing about problems in the supply chain. So what are the biggest challenges that we're facing right now in getting these ventilators where they need to go?
I mean, we definitely have a challenge in supply, but we're getting it done as a distributor, and we're supplying the states and the hospitals with the ventilators that they need, and we're getting it into the hands of the patients that are struggling with the coronavirus.
So, to your knowledge, nobody is dying because they do not have access to a ventilator?
Not at this moment. I feel good. I had some calls yesterday with our local hospital system here in Louisiana, and they assured me that they had the equipment that they needed. We also saw some signs of life from New York. We were sending them some ventilators, and they pulled back on an order to get them some vents. So that's all positive. I think that we're starting to see some stabilization on the systems having what they need.
Dr. McCormick, we know that you're there on the front lines. What has been your experience with ventilators? Are you having what you need to treat your patients?
Absolutely. As a matter of fact, this is the problem with the information age, that we get so much information, we actually get overburdened with infactual opinions. And one of the things that we found is that we were intubating too many people originally. As a matter of fact, the way that we're approaching medicine right now for COVID-infected patients and their respiratory failure, ventilation, especially for intubation, is actually a last resort. On a good case, you're going to survive 50% of the time when you're intubated. That's kind of scary. And it's much worse for COVID patients. You already have inflamed lungs that are not working well, and then you put pressurized amounts of air into that sort of patient, and you have worse outcomes. So what we're trying to do is other things: high flow nasal cannula, rebreathers, positioning on your prone position, in other words, on your face instead of on your back, trying to get better oxygenation, because once you intubate somebody and use a ventilator, their outcome is usually worse. So it is a last resort. And what we're finding is that's the reason that in New York, when we're treating patients a little bit different, we have lesser requirement for ventilators. I've heard that they're actually shipping them out to other states that have a possible need in the future. But I think as you see an evolution in the way we treat patients and the need for ventilators, we're going to be just fine.
And how about personal protective equipment that we've all come to know as PPE, Dr. McCormick? Have you had enough of that? So
that's been a pretty contentious issue as well. At first, we did not. Absolutely caught unawares. We had not enough of the protective gear we needed. We were reusing some in cases where we didn't want to. But I find that just like we always do in America, we've adapted very quickly. We've had ramped up production. We've had people from all over the world sending us supplies. We've had, I just had the Chinese Republicans donate some masks to our hospital just free of charge, 1,000 masks. And we may not have all the protective gear we need right now, but we're getting there really quickly. And actually, we're changing the way we're using our gear based on how much we have, and that's getting better daily.
Mr. Hoyt, can you explain to us, I know that President Trump has said that really ventilators, not a problem. Anyone who's needed one has received one. What has been your experience in accelerating this process? Has it been easy to cut through the red tape? If you could just share your thoughts with us.
Well, I mean, I think that the decisions that they've made over the past few weeks have been very swift and correct. In particular, as it relates to our industry, the CMS Administrator Seema Verna should be commended because she loosened up regulations on telehealth. This protected our clinicians in the home to have these telehealth solutions. We now have physicians, nurse practitioners, nutritional specialists that can all conduct a telehealth visit. That really keeps people safe. Our core business is putting respiratory therapists in the home to treat these patients. We need a telehealth solution as well, to where that we can keep our people safe and keep the patients safe and free up those beds that are much needed for the COVID patients right now inside of the hospital.
Okay. Thank you, gentlemen, for talking with us. Casey Hoyt and Dr. Richard McCormick. Doctor, thank you for all the work there on the front lines.